was your last appointment here?
Uh-huh.
I remember when you were first diagnosed. We were still at the old children's hospital.
Uh-huh.
I can't believe it's already 8 years. I don't know if I'm ready for this yet.
Jeez, Mom, pull it together. It's not a big deal. Or is it?
Good morning.
Hi.
Hi, we're here to check Trevor in.
Hi, Trevor. Just have a seat and we'll call you when the nurse is ready. Thank you. Thanks. Hey, Trevor.
Hey.
How are you doing?
Pretty good.
Hi.
It's pretty good.
Hi, Trevor. How are you?
I'm pretty good.
I can't believe this is our last visit together.
Yeah.
And you're going to be 18 soon.
I'm pretty excited.
When you think back over the things we've talked about, what comes to mind?
I don't know. I guess the people are nice. Coming here's been alright.
Have you thought about what it might be like to go to the adult endocrinologist?
Not really.
Take a seat. The nurse will be with you in a second.
I know it's going to be a different clinic. I guess it's going to look a little different.
Trevor!
Did you really think you could bring your mummy in here with you? Grow up.
I suppose the doctors there will treat you a little differently.
So you're Trevor. I see your A1C is not where it should be. You obviously aren't taking good care of yourself. You skipping insulin? So, why do I ask? Teenagers always lie anyways. Yeah, you're probably taking drugs too. Whatever. Look, take your insulin, eat better, exercise more. Stop taking drugs, don't drink, go to school and get a job. Now it's time for your exam.
It's true, things are a little different at the adult clinic. They'll expect you to make your own appointments and to reschedule them when you can't make them. There are a few different clinics for your doctor's visits. The nurse and the dietitian will work as a team, but aren't always at the same place as your doctor. That can be really helpful if you don't live right near the hospital, since we can find a location that's easier to get to. The buildings are different, but they're nice too. They're more geared towards the adults. When we decide who to refer you to, we'll make sure you can find your way there. The waiting room is for all the people in the clinic, so you'll see a variety of people of different ages there. Hopefully, if they're taking good care of their diabetes, you won't know who is a patient and who is a family member. When it's time to see the doctor, you're welcome to have your mom or another support person come in with you. But the doctor will mostly speak to you and expect you to know all about your diabetes and how it's managed. Clinic appointments are shorter, so it's important for you to ask questions at your appointments, if you have them. The doctors there expect to talk about things like family planning, alcohol, and school or work schedules, so don't be embarrassed or surprised if they bring those subjects up. Some people miss the family atmosphere at the children's hospital, but now that you're grown up, your team will expect you to be responsible for your health care. Just like we've been doing more and more over the past few years. That doesn't mean that you're not going to develop a relationship with your diabetes team, just that it's going to be different than when you were a kid. Do you have any questions?
No, I don't think so.
Sometimes it's hard for parents to believe that children are growing up and moving on to the adult clinic. I know we've been preparing for this for a long time now, but it's important for you to remember a few things. Trevor isn't a kid anymore, so he needs to be responsible for things we've been talking about. But that doesn't mean you're not important anymore. It would be great if you and Trevor could continue talking about his diabetes struggles and what things that might come up, and for you to keep supporting him so he can do it on his own. The adult endocrinologist will expect Trevor to be the person in charge of his own diabetes. But if you end up going to the appointments, it needs to be okay for Trevor to go in by himself for his follow-up and exams. All young adults need the chance to have a personal conversation with the doctors. It doesn't mean that they're doing something you don't like. It just means that they need to be able to take care of their own health care. Oh yeah, also remember that if you do go into the appointments with Trevor, you've got to let him answer the questions and not jump in. Think you can handle that?
I guess so. I've been thinking about this day for a while, and I was worried about how it would go. If I can't go to his appointments, how am I going to know what's happening with his diabetes?
Well, it's going to depend on how well you and Trevor communicate. You're going to have to make time to talk to him about changes in his diabetes and anything that comes up, because the doctor will not be talking to you separately. That's part of respecting Trevor as a partner in managing his own diabetes.
I think we can do that, right, Trev?
Yeah, for sure. This isn't going to be too bad.
A few things to remember. You will need to keep up with 2 separate sets of appointments in the adult clinics, one with the doctor and one with the nurse dietitian team. Parents have an important role to play in making sure that teens make and keep their appointments. If you have any problems in the transition process, you can still call us and we'll help you figure it out.